Hello, my name is Dr. Paul Olivo. I am the Chief Medical Officer at ImmunoProfile, and I am also an adjunct professor at Washington University Medical School in St. Louis, Missouri. I have had a long career developing and evaluating the performance and clinical utility of medical diagnostic tests. And today I would like to talk to you about the ImmunoProfile antibody test system. So to begin with, what is the ImmunoProfile antibody test system? This is a test that measures the level of antibodies in the blood to a panel of 11 infectious diseases, all of which vaccines are available for. The 11 diseases are listed in this slide, and they include measles, mumps, rubella, and polio viruses, tetanus toxin, diphtheria toxin, whooping cough, hepatitis A and B viruses, the chickenpox virus, and the bacteria Haemophilus influenza that causes serious infections in children. The ImmunoProfile antibody test system is quite unique. It's unique because it's the only antibody test that provides 11 titer tests simultaneously. Each of these 11 titer tests can be obtained individually at many laboratories, but it requires a full blood draw performed at the laboratory. Whereas the ImmunoProfile test uses a finger prick blood sample, and that sample can be obtained at any location, including one's home. So the test is ordered online, the kit arrives, a finger prick collection is done by the individual anywhere. The blood is put on a dry blood spot card, ships the card to the laboratory, and the test is run at a certified lab. So it's a very convenient test. The ImmunoProfile antibody test system is fully validated in all 50 states, including the District of Columbia. It is run in a fully certified laboratory. The test meets World Health Organization standards for all 11 tests, and it meets the highest level of accuracy possible. Let's step back and ask, what is an antibody titer test? An antibody titer test is a medical laboratory test that determines the amount of antibody specific to an infectious agent in the blood. The antibody level, also called a titer, is a reflection of the body's past exposure to an antigen, which is a foreign substance that the body does not recognize as self. What information does an antibody test result provide? Well, first of all, undetectable or low levels of antibody to a specific infectious agent is strong evidence that a person has not been infected or has not been vaccinated, or that the antibody levels have waned after a past infection or vaccination. In contrast, high levels of antibody correlate with protection from an infectious agent, but do not guarantee that a person will not become infected or become ill from a particular infectious disease. This is because antibodies are only one arm of the immune system. However, protective levels of antibody are associated with a significantly decreased likelihood that a person will experience a serious infection. So what are the reasons one might have to test for antibodies? Well, there are many situations where knowing your protection status against these infectious agents is needed. For instance, there are professional requirements. Nursing students are required to either get a specific vaccination or provide proof of vaccination or show evidence of antibody titers. Similarly, other healthcare professionals, hospitality workers, senior care workers, people in the education field may need to know their antibody titers. Women of childbearing age may use this test as part of preconception planning, and immunocompromised individuals who are very susceptible to these infectious agents may want to know their antibody levels. And then finally, this test can empower individuals with regard to their personal health. An individual may not remember or have documentation of vaccination. An individual may not know whether they had a good antibody response to a vaccine. And finally, an individual may have been vaccinated quite a long time ago and be concerned that their antibody levels have declined. The ImmunoProfile antibody test system results are provided in a very private and secure manner, and ImmunoProfile provides full electronic chain of custody. In addition, the results are shown in a very easily interpreted manner. If the protection levels are high, they are shown in green, whereas if they're low, they are shown in red. And this result is also provided with a numerical output for all 11 antibody tests. Some of you, when thinking about a blood test that measures multiple tests at the same time, may think of the company Theranos, which claimed that it could measure hundreds of different tests from a single drop of blood. It turned out that this test was done with unproven, unvalidated, and uncertified procedures, and it was completely non-transparent, and eventually shown that the claims were unfounded. In contrast, the ImmunoProfile test uses a proven testing platform for a single type of assay using a single detection method. It measures a single type of biomarker, that is antibody. And as we mentioned, it is done with the highest level of accuracy with a proven blood spot collection system, a proven multiplex diagnostic platform done by a company that is established and reputable, performed in a lab that is fully certified, and finally, we have obtained regulatory approval in the entire country. So in summary, the ImmunoProfile antibody test system is reliable, accurate, standardized, validated, has received full regulatory approval. In addition, it's both accessible and convenient, cost-effective relative to performing each of these tests individually. And from my perspective, most importantly, it provides very valuable medical information. And I thank you for your attention.